Giving single injection of 2% lignocaine in lower orbit in downward and lateral direction prevents globe perforation in phacosurgery of myopic eye. I am Professor Bashar and my colleagues did the study. And this is the study, and you know there is anesthetic requirements is phaco. Nature of cataract surgery depends on nature of cataract surgery, patient preference and surgeon preference. These are the local anesthesia, and there are two types of anesthesia for cataract surgery, especially in myopic patient. Complication of local anesthesia, that is globe perforation, retrobulbar hemorrhage, optic nerve injury, vasovagal agate, and intrathecal spread of this. And this is how the local anesthesia may cause globe perforation, and it is very rare in experienced hand, but more common in myopia. Whenever it happens, it causes severe pain, not always, absence of red reflex, excessively soft eye and or hard. Even with immediate recognition, the visual prognosis is poor, and it may noticed some years later on or immediate after, not immediate after operation. And myopic eyes has got that is 30-fold increased risk of perforation, and 45% patient has got local axial length of 26 millimeter more or less. And while local anesthesia perforation is more in myopes as thin sclera, limited space, and staphyloma. Limited space in the myopia is large eye, it accommodates the maximum of the orbit, no space is there, and staphyloma may puncture the globe if needle is pushed. Safe anesthesia for myopia is general anesthesia, is not for older patient, and like this. And topical anesthesia is also safe for myopic patient, but there is a risk. Whenever the phaco probe is taken out, there is a forward bulging of vitreous causing retinal tear and traction and causes tear formation. And local medial peribulbar anesthesia may cause there is a globe perforation if there is a medial staphyloma. But my technique is that is modified peribulbar anesthesia is more safe, and methods, that is purpose of study to see the outcome of this design of giving local anesthesia in interventional and observational, and study period 2010 to 2014. 95 eyes was choose for this purpose, and in this anesthetic agent, that is 8 ml of only 2% lignocaine was given in the lower orbit, outward and downward direction, and then after 2 or 3 minutes, that is echinacea was checked, and it was found that there is no globe movement in any direction, and full echinacea is acid. You can see that is patient can enact results, that is satisfactory, there is movement, there is no supplementary injection is needed. Only 2 patients faint during incision and IOL insertion, and no globe perforation and optic nerve injury, retrobulbar hemorrhage or vasovagal attack in this type of giving peribulbar anesthesia, modified peribulbar anesthesia. Satisfaction excellent, in 97.8%, and eyelid movement scores satisfactory. After surgery, 90 patients, that is 94.7%, was able to close or open the surgery, open his eyes. Only 5% need, there is passes after surgery for 10 minutes. 2 patients feel pain after operation and was relieved by taking local analgesic. Topical anesthesia is more accepted worldwide, but TA is not and cannot be suitable for patient. TA is not suitable for phaco surgery in myopes, as it is cause vitreous pooling leading to tear formation. There is, in this study, we evaluate the efficacy of modified peribulbar block in myopic eyes and found better result. In the same time, the patient can open eyes like TA, as we used only 2% lignocaine. after surgery. This can happen. That is like as that topical anesthesia. This should be the technique of choice. In conclusion, I want to say using single local anesthesia injection only 2% lignocaine in the lower orbit in the downward and lateral direction in the phacosurgery of myopic eye is safe and prevent complication. These are the reference. Thanks for patience of hearing.